Greetings, everybody. I'll say good afternoon from Iowa City. I mentioned in the chat window just a few minutes ago as we were all comparing weather reports. It's beautiful and sunny here, which is not customary for our August weather. So I hope wherever you're tuning in from, your weather is doing well and you're staying healthy. So as Matt mentioned, today's topic is going to be that of digital dental photography. It's a topic that I'm very passionate about and that I have a lot of interest in. And I think, it has increasingly gotten more attention probably in the last 5 to 10 years. Really, the title of my talk is about using digital photography to increase proficiency as well as improving outcomes. And I think those are two important factors because I can tell you, at least from my experience as an adopter of digital photography, I have found that it has made me not only a better clinician, but because I've been able to evaluate my own work critically, but it allows me to really increase and leverage the amount of information that I can transmit to others that I work with, whether that be referral surgeons or collaborators in the laboratory side of things, or even other colleagues. Those are wonderful resources to be able to use with photography. The word photography actually means literally painting with light. And even though when we think of dental photography, we don't usually think of artistic photography. In a way, we are really using light to kind of paint the oral cavity. As we'll talk about later today, one of the biggest obstacles to obtaining good photographs is the ability to properly retract. And that's because we want to illuminate the intraoral environment and the teeth or the mucosa that we're trying to photograph. So really we are, in a sense, painting with light, but just in a way that tries to help us either diagnose or transmit information, whether it's documentation or more of an expressive form of photography as it pertains to dentistry. So in today's talk, what I'm going to try to do in an hour, which is certainly a tall order because photography has so many facets in it, is just try to cover some of the highlights that you see here as to factors that I think really can leverage and improve the type of photography that you do day in and day out in your practice. One of the things that I think it's important to start with is to say that photography is just another tool like anything else we use in dentistry. And like anything in dentistry, you have to practice it and actually perform it regularly if you want to improve. I think if you ask anyone who has achieved success in their photography and you ask them, are their photographs that they're taking today as good or better than what they were taking a year from now, or perhaps 3 years or 10 years, depending on where they are in their career? And certainly if you continue to do it and use it in your practice, you will find increasingly that your photographs become better quality and actually you can do more variable things with your photographs than you were perhaps when you're early on starting. So the first topic that we're going to look at as it pertains to dental photography is how you can use it to really promote what you're doing in your office. Whether you're on the surgical side of things or you're like me who's a restorative dentist, you can really use dental photography to really do a number of factors related to promoting what you do. I think one of the first things that you can do is you can promote what you're doing in your practice in terms of patient education, actually looking at a patient that presents and using it as another tool to diagnose, treatment plan, and communicate with your patients on what is going on in their mouths. The other thing that you can use dental photography for, though, is external advertising. And these days, obviously, with a plethora of different electronic and digital platforms to actually share your photographs with, whether it be on social media or brick and mortar websites, you have a host of different types of people who are landing on those types of pages. Here you can see a graphic of just some basic demographics, all the way from baby boomers, who are making up a larger share of the population these days as our population ages, all the way down to Gen Z, who are the current dental students that we work with today. All of these different patients who might reach your digital platform, whatever that platform may be, are going to have different ways in which they actually acquire those images and interact with them. If we take for a moment the baby boom or Gen X generation, I'm myself kind of caught between the Gen X and millennial generation myself, but if you look at sort of the baby boomers and Gen Xers, they really came of age, digitally speaking, using the World Wide Web and brick and mortar websites. Okay, so if you go to a meeting, let's say, and you're talking with a colleague, and that colleague were to tell you that they found an excellent ceramics team that they've enjoyed working with these past few months, and they think that you might want to try them, most of the time, if you're talking with somebody in a baby boom or Gen X generation, and again, I'm oversimplifying things here, oftentimes what they're going to do is they're going to pull out their smartphone, or they're going to go back to their office computer on Monday, and they're going to go ahead and pull up a Google website and actually Google that individual or that group that you may have discussed in that conversation. And it's important that you recognize that brick and mortar websites are still an important aspect of trying to express what it is that you do in your practice. It's kind of like a physical address, if you will, with snail mail compared to some of the social media outlets that we have now, and that it's basically a home where patients can go and get information. They can see what you do in your practice, what it is that you're passionate about, and find out more information in terms of becoming a patient or perhaps seeking care at your office. So this is just a website taken from Absolute Dental Services. They're a wonderful laboratory based in the Triangle area of North Carolina, also a Peers member, and I've worked with Conrad Rensburg and Jack Morano, who are really the leaders at this laboratory. And you can see just from some screen captures of their website, you get a very quick feeling of who their team is, what they're passionate about. And if you scroll a little bit further in the website, you can see examples clinically of the type of work that they do for their referral dentists, as well as the team of ceramists who really comprise their group. And this really creates a sense of belonging and getting people who land on that website to get to know who they are better. And if you click on some of the photos in their website, I'd encourage you to go visit it. It's a really nice website. You can see very nice photography that really highlights all the steps of what they offer and the different treatment options that they can bring to their clients. So definitely dental photography can be used not only on the laboratory industry side of things, but obviously for us as clinicians on very traditional brick and mortar websites. The website that I'm showing you on the left-hand side is actually a periodontist here in Iowa City, Dr. Derek Borgwart, who I worked with as a resident. And you can see some cases here in the treatment gallery of actually cases we did together when he was wrapping up his residency. And on the right-hand side, you can see an example of a periodontist that we've given CE courses for, Dr. Natalie Frost in the Omaha area, and just showing some quick photographs of services that they both offer in their respective periodontal practices, and giving patients an idea of what they can expect if they have a similar problem. One thing that I would say is that as a general rule, while it's great to have beautiful intraoral dental photographs, I would encourage you, if you're looking to broaden the scope of your photography, to also include portrait photography. And this is a way to kind of humanize the patient, because patients don't always react like we do as clinicians to teeth and mucosa. They reflect basically the story of that patient and how the patient actually ended up looking from more of a social or visual standpoint as a whole patient, not just the teeth and the intraoral condition. So as you can see on the left-hand side, this is a static image of Dr. Thomas Jackson's website in the Chicagoland area. And again, being able to humanize the patient by having some portrait photographs. Another thing that you're seeing trend-wise, if you visit any dental websites or if you've gone to any recently, is increasingly you're going to see more and more websites that are using video tutorials or case reviews of patients that have actually had care done at a dental office and how that's impacted them from a personal standpoint. I thought I'd share one example of one of these cases with you just to give a flavor of how an endodontist is using documenting photography and video to actually get this point across. So let's take a listen.
Kenyon Murray, Cedar Rapids, Iowa, and actually had a root canal done on number 8. Dr. Moriel has definitely created a family-friendly office. The girls there are fantastic as well. I think she's done a great job as far as selecting the people that represent her, both as assistants and her front desk. Dr. Moriel is very, very down to earth, so she makes the whole experience very comforting and easy for someone coming in as a patient. I highly recommend Apex Endodontics just for the simple fact that, you know, when you walk into those doors, the staff and Dr. Moriel they're there for you as a patient, because a lot of times patients come in with a lot of tooth pain, and they're going to make sure that they do everything to make you feel better when you walk out those doors.
So if you were to see that as a potential patient, I think that can actually be very persuasive and actually maybe actually make you want to take action to perhaps seek care at that office. So definitely dentistry is a visual type of treatment, and so I think it lends itself naturally to photography or video testimonials, as you'll probably see more and more. One thing that I can tell you is that when you visit a lot of websites, you'd be surprised how many dental websites have no examples of clinical treatment that they offer. They'll have stock images of a smile or a crown, but they don't really have any images that really personalize what they're doing in their office. So I think definitely incorporating photography into those aspects will allow you to actually create more of an authentic presence digitally. If we look, though, at the other end of the spectrum and we look at sort of the younger age groups, the millennials or Gen Z, the way that they're going to approach digital information is going to be a lot different as compared to the groups that we just talked about. For them, the World Wide Web is kind of like the horse and buggy, right? They're not going to sort of stock web pages or brick and mortar websites, if you will, to really get the lion's share of their information. So, you know, early on in the era of social media, really social media centered around Facebook and YouTube. And certainly having a digital presence in these mediums is certainly advantageous. And you can utilize photography both on your Facebook pages as well as if you're doing any kind of videography with YouTube to perhaps transmit information to your patients, talk about what kind of services you offer. What I will say, though, is that these two platforms really in the last few years have been, I don't want to say overrun, but maybe overtaken predominantly by Instagram. And Instagram has really taken over, I think, organically in dentistry for a couple of reasons. One, it allows you naturally to share visual information, whether it be more of a creative style or in terms of actual clinical documentation. It also blends the social capacity of Facebook in that you can actually utilize your photography to connect with others that have similar interests, whether they be other colleagues or perhaps other groups. So you can see here some groups that I follow on my Instagram account, anywhere from the Academy of Osseointegration to laboratories or other colleagues that I may work with, and then even people that I work with on a daily basis here at the university and in study clubs and groups that I interact with nationally. So again, being able to have nice photography that you can share will certainly allow you to build your presence digitally. In terms of other things more practically that you can do with your digital photography, I think one of the important things when we talk about day in and day out clinical dentistry is the importance of having a legal record of what you're doing. This becomes a bigger issue in more complex treatment. And you want to make sure that if you're going to start incorporating digital photography as part of your practice, that you make sure to really do your homework and develop a good consent form. Okay, I can share with you an example of our consent form that we use at the University of Iowa College of Dentistry. And basically there's a couple of key factors that any good consent form is going to have as part of your digital documentation workflow. This is an example of one of the early paragraphs of our consent form at the university, and you can see that we clearly spell out why we're going to be taking images of our particular patients. And this is going to be used for educational purposes with our students, our residents, or for any educational purposes outside of the college. In addition to saying what you're going to do with the photographs, it's important to tell the patients in the consent form from a legal perspective of where these images may be used or displayed after they're taken. So if your only purposes are internal, then you may want to go ahead and spell that out in your consent form. However, if you're somebody that perhaps wants to use the images in a study club, or you're going to be using this from an outside perspective for marketing or other purposes, you're definitely going to want to have that in your consent form, because if you don't have that and somebody were to legally challenge you, that's going to be something that's going to be hard to defend in a court of law. So you want to make sure that when you're taking photographs that you first always get that consent process before you start taking any images. I think naturally one of the first applications that you can start doing with your dental photography is very simply a static before and a static after treatment. Okay, and again, I think if you can incorporate some kind of portrait photography as to how the teeth and the mucosa and whatever other treatment that you rendered for that patient, how it altered their facial aesthetics, that can be all the much more powerful. I think with these 5 simple images, I could send this case to my patient, and this becomes now a piece that he can show his family members, his friends, other colleagues, whoever he feels comfortable with. And this not only becomes something that he's excited to share, but also patients are naturally going to ask, where did you have that treatment done, or how did you get such a wonderful end result? And so that can actually be a very powerful tool in terms of a soft tool to actually be able to market what you do so well in your practice. So certainly that's a place to start with your dental photography. As you get more advanced in your photography, you may want to find, or you may find, that you can utilize it to document critical steps that you do in your patient treatment. This was a patient that we treated some time ago who sought single tooth implant care for congenitally missing laterals. She had resin bonded FPDs to start, but she had had repeated episodes of these debonding and actually wanted to go with a more permanent solution. So we worked up her case, did a very thorough case analysis, signed treatment plan, documented everything. But what became really critical in this case is that one of the first things that we had to do in her case was to actually go ahead and do alveolar ridge augmentation, because she had a deficiency in her residual ridges at these sites. So Dr. Avila Ortiz, who was the surgeon that I was collaborating on this case with, actually took photographs intraoperatively during the surgical rendering of treatment. And this was a very straightforward case. It was very easy for him to go ahead and augment the ridge, close up the site. But what happened that was unexpected was that when the patient called us about 72 hours after the surgery, she had an acute episode of facial swelling with extraoral bruising. Okay, and this was the actual photograph that we took when she came into the clinic, but she actually sent us a photograph with her smartphone just to kind of show us what exactly was going on. Now, she was a very understanding patient. In this case, she just had an acute response as a redhead patient. Sometimes these patients have more of an acute response to surgery. She had never had any oral surgery prior to this experience. So everything progressed well in terms of the healing. When we saw her back a couple of weeks later, the swelling had reduced, and she went on to have a very successful outcome. 5 months later, we were able to place the implants using guided surgery in the augmented ridges. And you can see here the digital plan that we had for her. And after a period of time with a provisional restoration at both sites, we were able to take shade photographs and then get a very predictable and pleasing result for her in the end. She was very happy with treatment, but if she was a less than understanding patient and perhaps had more of a litigious streak in her, let's say, she may have brought some kind of legal challenge. So certainly having these photographs at hand, if you had to defend what you did clinically for that patient, could become a very decisive factor if you were brought before a peer group to evaluate whether you were operating under the standard of care. So definitely it can be used for that perspective. Another thing that we've experienced here at the university, and I'm sure that you've experienced this in private practice, is the ability to actually pre-authorize proposed treatment. So this was a patient who also presented in our periodontics clinic. The patient had a mucogingival recession defect, and if you look at what we submitted to the insurance company, it was basically just an odontogram and a radiograph. Okay, but with that information and a written narrative, the patient was denied any kind of coverage by their insurance policy. When we brought the patient back, we actually went ahead and documented the case a little bit further with some clinical photographs, both from the frontal perspective as well as from the occlusal perspective, and then wrote a more thorough narrative. Lo and behold, when that narrative was reviewed, the patient's insurance actually, the second time around, actually approved the mucogingival procedure. And so the patient was able to successfully undergo a subepithelial connective tissue graft. And you can see the end result that Dr. Avila Ortiz was able to achieve for this patient. Again, had we not had those clinical photographs, this may have been the difference between this patient either not getting the care or paying out of pocket versus being able to utilize their benefit that they had been paying into all along through their insurance. So I think from a medical legal perspective as well as from a claims perspective, dental photography, if done correctly, can certainly be to your advantage. What I'd like to do, though, is spend some time now talking about the principles of dental photography. I think one of the biggest things that's of confusion when people look at adopting clinical photography beyond using just automatic point and shoot or smartphone cameras is understanding really what goes into composing a pleasing image from what we would call an overall exposure. Okay, so there's different factors, what we call sort of a triad of factors that we're looking at right here, which go into composing that photograph. The three factors that we're going to look at are what we call the ISO, which is basically a sensitivity of the camera's sensor to photons of light. We're going to look at the shutter speed, and then we're also going to look at the bottom at what we call aperture. Okay, so I'll go into further detail on these different factors, but basically all three of these factors come together in sort of an amalgamation, if you will, to actually determine what the final exposure of that clinical photograph is going to look like. So let's take a look at ISO here. ISO is basically an acronym for International Standards Organization. Basically what this is it's a standardization of how sensitive the digital sensor is to a light source. And really this dates back to the old days of film photography, where if you were going into an environment where perhaps you wanted to have more sensitivity of your film to light, if you're going into a dark environment, you would purchase a higher speed film, okay, or what we call an ISO film that had a higher number. This would make that film more sensitive to light and be able to produce an exposure that could be rendered successfully. Nowadays with digital sensors, it's the same thing, but instead of using film, we're using actually a CCD or CMOS sensor that actually is sensitive to those incoming rays of light that come through the actual camera body. So you may say, you know, in dental photography, if I want to be more sensitized to light, because we know in the oral cavity there's not a lot of endogenous light, why don't we just crank up the ISO and then we can avoid some of these pitfalls that we often find in the oral cavity? And at first blush, that seems to be a very sensible approach. The problem is that as you increase the ISO from left to right, from a low ISO to a high ISO, while you will increase the sensitivity of that sensor to light, it comes at the reverse expense of what we call digital noise. So in the old days of film, you would have a grainier image because of the film. Now in digital photography, you're going to have more digital artifacts, or what we call noise, as a result of boosting this ISO. So I've kind of shown you at the bottom here what the example of a photograph of a completely black source looks like when you increase the camera's ISO. And you can see if you're shooting at ISO 80 on the bottom left, you're going to have relatively little, if any, digital artifacts or noise. However, as we increase this up to ISO 3200 at the far right, you can see that while the sensor is definitely picking up more light, there's also much more artifact being imposed in that particular image. And this is going to render as a less than ideal photograph because of this digital noise or pixelation. Okay, so in digital dental photography, what we can do is we can overcome this because we're actually going to illuminate the oral cavity with a flash. And we'll talk a little bit later about different strategies for employing flash photography in the oral cavity. But what I'd like to do is just show you what happens when you increase the ISO and keeping all the other parameters of your camera consistent. All right, as you see on the bottom left, if I'm shooting at ISO 100, the image is slightly, at least for this camera, underexposed. It's not really until I get to ISO about 200 that we see an exposure that actually looks pretty reasonable. However, as I go to ISO 800 or 1600, I quickly overshoot the ideal exposure, and I'm definitely into an exposure that looks much more overexposed, where the teeth are just completely blown out and all we're seeing is a little bit of the mucosa. So again, in dental photography, what we want to do is we want to try to strive for using the lowest ISO possible and compensating by using a higher amount of flash in the oral cavity. There's really no need in dental photography to be shooting with ambient light and increasing the ISO, because we can actually change that just by using our flash source. So the next factor we want to look at is what we call the shutter speed. Okay, the shutter speed is basically a rendering or a representation of how quickly the shutter opens and closes to allow light to pass through into the camera. So it's a fractional number, so it's 1 over x, and x represents how long a period of time the shutter remains open. So if you have a solid number of 1, that represents 1 second that the shutter is going to be open for light to reach the digital sensor. However, if you have at the other end of the spectrum 1 over 500, that means that shutter is going to be open for 1/500th of a second. So you can imagine that's going to be a very quick exposure, and will freeze flash the frame for any motion that's taking place. So again, faster speeds are going to happen at a higher fractional number. So 1 over 500 is going to be much faster freeze frame as compared to a 1/2 a second or 1 second shutter speed, where we're going to get slower speeds, more light coming into the camera, but at the expense of what we call motion or motion blur. Okay. Now, motion blur is not always a bad thing. We can use this creatively in artistic photography if we want to create a sense of motion or dynamism in the photograph. So a good example here is this pinwheel. All right. If we're twirling the pinwheel and we take a photograph at 1 second interval, so that shutter is open for an entire second before it closes, because of the amount of time that elapses, that shutter, that pinwheel is going to look blurry because it's been spinning during that entire second. However, if we shoot at 1/500th of a second, it's going to appear to the viewer that that pinwheel is not spinning whatsoever, that it's completely still. So again, it just depends on what you're trying to achieve with your photography in general. In dentistry, we're not usually trying to create a sense of motion or dynamism with the teeth or the mucosa. We want to document what's clinically visible. So again, we're going to be shooting at shutter speeds that are going to be farther to the left end of the spectrum rather than to the right. Okay. And again, you can probably experience these different speeds when you look at photographs. A traditional use of this is trying to photograph waterfalls. So you can see on the far left, if we take a fast shutter speed photograph, the water is going to be flash frozen and it's going to look like a still image capture. However, if we take a 1/2 second or second exposure of that same waterfall, it's going to create a silky rendering of the water, again, creating that sense of motion or dynamism. And as somebody who enjoys photography myself, these were a couple of photographs that I've taken of waterfalls up in the northeast section of the United States during the autumn. Again, longer shutter speeds and doing different filtration to try to actually create a sense of dynamic change in that particular photographic setting. But again, in dental photography, we're not interested in that. We want to document what's present with a still image. So again, you're going to be using faster shutter speeds. And we'll get into those specific settings in just a little bit. The last and probably most important factor to good digital dental photography is getting your aperture setting correct. Aperture is probably the most confusing term or factor, I think, when you're new to photography. And I know it was for me when I first started educating myself on photography. One of the things that's difficult about understanding aperture is what we call the f-stop. Like the shutter speed, the f-stop is a fractional number, so it's an f over a certain number. Basically, what you can remember is that it's an inverse relationship. So as your f-stop becomes larger, like at f22 on the right side of the screen, that has an inverse relationship with the iris diaphragmatic opening. So at f22, we're going to be stopping down that diaphragmatic opening and letting a very small amount of light into the sensor. Okay, as compared to the left at f2.8 as a smaller aperture, we're now dilated and we're allowing a lot more light per unit time frame to reach the sensor. So again, you may say in dental photography, we want lots of light, right? So why not just shoot at a small aperture? And again, that would be a good supposition. However, the problem is, like most things in photography, is that when you let in more light, it's at the expense of what we call the depth of field. All right. Depth of field basically is a term that tells you how much rendering from front to back of the photograph in the field of view is in what we call the focal plane or focal trough. Okay, so if we shoot at something that is at a f2.8, that focal trough is going to be very narrow, and so we're going to see a smaller focal plane with more aspect of the photograph that's going to be blurry in the back and in the front of that focal plane. What I wanted to share with you first, though, is just a graphic rendering of how the f-stop impacts the actual shutter of your camera lens. So again, if we're looking at f1.8, you can see, again, a large diaphragmatic opening at that small f-stop. As we increase the f-stop, it constricts the iris and allows for less light, but again, it's going to give us a higher depth of field. More in the photograph will be in that focal trough as compared to the left side of the screen. The other thing to note is that for every f-stop that you change, going from a smaller to a larger f-stop, each individual step represents an attenuation by 1/2 of the amount of light. So as we go from f1.8 to f2.8, we've now decreased by half, or 50%, the amount of light that's going to reach our camera sensor. So that's another thing to keep in mind as you're changing that f-stop. And again, if we're taking some example photographs here of some figurines, you can see that at f2 or 2.8, that focal trough is very narrow. Most of the photograph is going to be a blurry rendering of what's in back and in front of that focal plane. As we get to the larger f-stops, f16, f22, now we're not only seeing all of the figurine faces, but we're actually seeing a clear rendering of the texture of the cloth that's behind the figurines themselves that you couldn't even make out at f2. So you can see that as you increase that f-stop, it's going to render more in focus. And that's important for us in dental photography because oftentimes, not always, but oftentimes, especially when we're doing initial exams or diagnosing and treatment planning, we're going to want to have as much of the oral cavity to be in that focal plane as possible. We don't want to just have the central incisors in focus and everything in back of it out of focus. So again, if we change no other parameter other than the f-stop, with all other parameters being held constant, you can see as we increase that f-stop, as we close down that diaphragmatic opening, we're letting less light into the camera, and as a result, our exposure becomes quite a bit decreased at f36 as compared to f14. Okay, so those are the real 3 factors to look at. And again, we'll go over sort of what the desired settings are, but basically these 3 pillars or stools of the leg, if you will, are going to be what's going to support your overall exposure rendering, okay, all together when taken into summation. Now, as you change one factor, you have to think about how that's going to impact the others. So if you're going to change your f-stop and let in less light, then you have to be thinking, do I need to boost my flash or change my shutter speed to accommodate those things to still get a good exposure? One of the most powerful things I think that you can use in most digital cameras, and especially if we're talking about DSLRs, which I think is, at least from what I saw in the survey, what most of you are using, one of the most powerful tools that you can use is the camera's histogram. Okay, pretty much every DSLR that I'm aware of, if you take a photograph, you should be able through the menu structure to be able to bring up what's called a histogram. The histogram basically represents a graphical rendering of your exposure. Okay, and what we're going to do is look at, in a patient photograph situation, how the rendering can be read on the histogram. Oftentimes when you get good at photography, you don't even necessarily need to look at the photograph itself to know if that was rendered with a correct exposure. You can actually look at the histogram and get pretty much all the information you need. So if we take a look at this patient's extraoral smile photograph, we can all look at the photograph and visually say that this appears to have a pretty reasonably good rendering. The exposure looks well balanced. We can make out the skin and the teeth and the mucosa without really having to make any large adjustments. The way that I know that also, if I never even saw the image though, is by looking at my histogram that you see on the bottom right. What you can see is with a well-exposed image, the histogram is going to typically be centered in the middle of the histogram rendering. as you see here, we have two peaks, and those peaks mostly fall in the center of the histogram. The reason we have two peaks is that when you're taking a lot of dental photography, you're going to have one peak in the center, which typically represents the skin or the lips, and you're going to have a second peak slightly to the right, which is going to represent the teeth or the dentition that you're photographing. The reason that the teeth are slightly to the right is anything to the right represents something that's slightly overexposed. Anything to the left of middle represents something that's more underexposed. So because the teeth have a larger exposure compensation, they're going to have a slight small peak to the right of the center of that histogram. Okay? If we take this photograph and we artificially make it too dark, what you can see is that if I now look at my new histogram that results from this, the histogram has a leftward shift to something that looks more underexposed. I still have two peaks representing the skin and the teeth, but both of those peaks have been shifted now to the left. However, if we go to a situation where we artificially overexpose the image, now my histogram is going to move to the right, again because it's overexposed. The other thing that you'll see is that the peak, the top of that histogram is now cut off at the top. And that's a phenomenon that we call clipping. So clipping is when the pixels of the brightest whites essentially are off of the black and white spectrum, and so it's basically pure white. So this is an example. If you saw this on a histogram of a photograph you took, even if you never saw the photograph, you would know that this photograph is completely overexposed. So again, using the histogram is a powerful tool. One of the other things that's very important in dental photography is to be able to effectively set your white balance. The white balance is basically a temperature reading of the light source that is impacting your particular photograph. Okay? So in dental photography, there's going to be basically two light sources that are impacting that Kelvin temperature that's registered as what we call the white balance. The two light sources are going to be the ambient light source in your operatory and then the actual flash light source that you're using on your camera. So basically what you want to do is you want to accommodate for those light sources in your camera so that you're effectively registering the temperature of that patient's intraoral situation with corrected lighting. Again, most SLRs are going to have some kind of white balance setting. And again, you'll have to read or go in the manual of your particular camera model that you're using. But I can tell you as a Nikon user that Nikon SLRs unanimously have a white balance setting where you can go in and set to preset values or customize the white balance to whatever setting you deem most acceptable. If you're new to dental photography and you don't want to get into the nitty-gritty of setting your white balance, what I would suggest is that you start off by selecting the flash white balance setting. That is a good basic place to start from. Flash photography for most systems will put you at a color temperature of roughly anywhere between 55 to 5600 Kelvin. Okay, and you can see an example of what that flash automatic setting looks like in the middle left column there. The problem is if we use the auto white balance setting or shade or other settings, we can quickly distort the color rendering of that photograph. And so you can see with the same clinical photograph but at different white balance setting how that can distort the color. Even though we might still be able to glean valuable information from these photographs, if we're looking to transmit information to our laboratory technician or to others who might be treating this patient, if we send a color incorrect photo, that can mean the difference between success or failure depending on what we're trying to accomplish for that patient care. So again, if you're just new to photography or you're just setting up your photographic workflow, I would recommend as a starting point to just set up your flash white balance based on the settings that are in the camera for that flash setting. And again, that's going to be between about 5500 to 5600 Kelvin. If you're getting more comfortable with those settings or if you're already accustomed to photography, you can actually customize the white balance. What does that mean? Well, when you customize the white balance, what you're doing is you're saying that you want to be in that flash setting, but you also want to accommodate for the temperature of the overhead light as well as the flash setting that's in your photograph. So what you want to do is you can use various products to go ahead and actually customize the white balance settings. We don't have time to go into all the specifics of how to do that, but I would implore you to look at those websites or look at your camera manufacturer in terms of how to set those custom white balance settings.